All right. Well, again, welcome, Aaron and Robert. Thank you so much for hanging in there while we worked to try and get that live on Facebook. We're so excited to have you join us this evening. Welcome to our 6th town hall. We will be answering any questions that you have, so feel free to post them either in the chat or the Q&A. Either is completely fine. We'll be watching both. And tonight I am pleased to introduce you to Carla Bailey-Smith, candidate for District 88 State Rep. Carla?
Thank you, Kelsey, and thank you for hosting again. And I'm sorry the Facebook Live isn't cooperating this evening. Usually we're able to broadcast this directly to Facebook Live. So if you're watching it later, we did try. Thank you everybody for tuning in tonight. And I am so happy to share this time with my new friend and fellow candidate, Abbi Sorrells, who is running for McLean County Coroner. I have previously spoken about how I did not understand why so many people on the ballot go unopposed. And for people to step up and run for office, it really helps to know there's a structure in place, people to help and work and support you. And even though I'm running for office myself, Abbi and I have a lot of square mileage and a lot of voters and residents in common who we both want to reach out to. So Abbi, could you please tell us a little bit about your background and when you started thinking about running for coroner?
Sure. My background is pretty broad, actually. I'm a veteran from the Illinois Army National Guard.
Oh.
And originally I went into molecular biology. That was my major. And I was going to go to medical school because I thought that was the route I needed to go to be the coroner.
Wait. So you wanted to be a coroner before you went to medical school. So you were thinking about this a long time ago?
Yes, I decided in undergraduate school, probably my first year in, that I wanted to do that. And so I talked to some people who knew a few people who were coroners, and they were like, well, you really don't need to go to medical school for that. That's not, really the recommendation. So I ended up changing my major to nursing, and I finished my bachelor's degree at St. Francis College of Nursing in Peoria. And then started working at St. Francis, and I've worked all across the spectrum in nursing. So I started off in high-risk pregnancy, and I always knew I was going to end up in the emergency department because that is my true love. So after a year of doing that as a nurse, I went to the emergency department, and I've been doing emergency nursing since 2014. And I even spent some time working as a flight nurse, which was kind of a combination of critical care and emergency nursing. And I really loved that as well. And I've also done some hospice case management, so some end-of-life care, which really involves the patient and the family together. So I felt like those were really good backgrounds to have for someone who wanted to be the coroner. So I've kind of always lived my nursing career in a way that would guide me to be the best in that position. I am currently finishing my master's degree at Chamberlain University as a nurse practitioner. So I'll be done with that next month.
Great. Let's see. So I don't think I knew. I've learned some things about you, but I don't think I knew about the hospice care, and that's very interesting to me because as a coroner, my understanding is that you're the first person on the scene, and you would have to interact directly, perhaps, with the bereaved family. Is that correct?
Yes. So there's a lot of times there's a misconception in what the role of the coroner is. The coroner does not perform autopsies. We actually have a forensic pathologist that has to be done by a medical doctor. And that's all things that are written into the laws and regulations for the state of Illinois for the coroner's office. So the coroner's position is more of an administrative role in the face of the coroner's office. So it's a lot of interactions with law enforcement, EMS, hospital staff, as well as families of the decedent. So it's really important to have that all-around experience to be able to provide the needs for all of those different venues and the areas that you'll be working in.
Right, right. So how does the coroner affect our community and our health concerns?
So one of the big things that I would like to do in the office is to address some of our crises that we have been dealing with. So the opioid crises, suicide, and mental health in general. But then there's some other things too to look at, like, you know, heart disease and implementing smoking cessation programs and healthier lifestyles. So I feel that the coroner's office has a truly unique role in that they see the types of deaths that are affecting the people in our community. And with my medical background, I understand things that we can do to implement some changes to affect those numbers in a positive way. And we have a lot of community programs that are already in place. And if we could work collaboratively with them, then we would be able to establish programs that could make these numbers better for our county.
Right, right. Okay. So so when did you actually decide to start getting yourself ready to run for this position?
So I've always known that I was going to do that. So I've always tried to seek opportunities that would make me a better coroner in my role as a nurse. In 2015, I was approached by some members of the community and asked to run then, and I just was not ready. I was thinking about starting the master's program, and I was more focused on my family. I had a much younger family at that time, and so it just wasn't a good time for me to run. So it's something that's always been in the conversation in our house with my husband and myself. Sorry, I have to do that or my phone's going to start ringing to my computer.
Oh, yep.
Everything's connected. So, so it was just an ongoing conversation. And then later in 2019, some people approached me again, and it was really a 5-minute conversation with my husband because it's something we had always discussed.
Right.
And so I called my friend Eric Rankin, who I had no idea was like politically involved in any way because we've never talked politics before. And so I called him for some advice because I don't know politics. I was like, I know I want to run for this seat, and I don't know what the logistics of that are. And so I talked to him, and like the next day I called him back and was like, let's do it. So it was a pretty quick decision.
Yeah. I love hearing the story about how you and Eric Rankin just went to the same gym together, and you never knew that he was involved in politics at all, and you were working out next to the chair of the Democratic Party of McLean County.
I had no idea. I had no idea. I just knew he was a political science professor at Illinois State, and so I was like, oh, I bet he has some good information for me. And he did. He had a lot of good information.
Yeah. Well, I remember being at the meeting when it was announced that you were running, and I was just so excited that we had somebody to run for coroner, because I was really at that time still coming to grips with why it's important that we have a qualified and empathetic coroner. Can you think of any other reasons why we vote for the coroner, or perhaps from a policy and services standpoint, why it's important to have a qualified coroner?
So I'm not really sure why we vote for a coroner. I guess I could see both sides of the fence. You know, if it's always an appointed person, you might not always choose the most appropriate candidate. So I do like the election process, and that it lets the people of the county decide, as opposed to just, you know, if it was someone that was going to be appointed. Right now, if a coroner leaves midterm, the county board appoints them. So I feel like there's a small group of people who would then get to make that decision for the county overall. So I do like the election process. I do think it's odd that it's a partisan seat, as well as, you know, a lot of the other county-wide seats in general. There's no political pull in this seat at all. You follow state guidelines and regulations that are set forth by the state, and you operate within those guidelines. So you don't implement policy change overall. I mean, like, for me, I see myself implementing change and, you know, working with other agencies in the community and more education and outreach. But overall, I'm not changing any law by working in the coroner's seat. So I think that it's kind of odd that it's a political role, because you're there to serve everyone in your county. So
Right. But what you were saying before about, for instance, the opioid deaths, and you know, if there's a spike in suicides, if there seem to be an unusual number of heart disease cases, then you would want to raise red flags and talk to the appropriate people in the community, so that we go that step further and say, hey, this is a thing that's happening, and we need to look at why this is happening and how we can reduce these harms to our community. I did want to ask about COVID-19, if there's anything that coroners, you know, all over the United States, if there are best practices in place. I know that there's a lot of misconception out there about the numbers. You know, people don't believe the numbers, which I suppose is a separate issue. But what should the coroners across the country be doing with people who are suspected COVID-19 deaths?
So I think there's two different sides of this. So there are times when it's already a confirmed case. So obviously COVID could have played a role in that. Even if they have underlying health conditions, it wouldn't be their primary cause of death, but it could be their secondary or contributing factor to what caused them ultimately to succumb to what their primary illness was. So I think it's very important, if we don't have a confirmed diagnosis by testing, that we do postmortem testing. And there are guidelines set forth by the Centers for Disease Control, the CDC. There's actually a whole page of their recommendations and guidelines for postmortem testing. I know that we recently had a case in the county that was classified as a COVID-related death that ended up being a negative. They weren't exposed to COVID and they were negative. And I don't know if they were tested or how that came about, or if there was a test that was pending, because some of those tests take 7 to 10 days for the results to come back. But in my practice in the emergency department, I have seen people present with the symptoms of COVID and have imaging results that are very indicative of COVID, and then have their swab come back negative. So I think it's very important to not just go based on their symptoms before passing, but also making sure that we're being good stewards of that diagnosis, because I think that to put that on the certificate and for the coroner to sign their name on the bottom of that, you're taking responsibility for what you have put on that. And I want to know definitively that they were positive or they were not, because it just gives the members of our community more comfort knowing that we're doing everything we can to make sure that our numbers are accurate. And I think it goes for saying in the other direction where, you know, we're not positive if they had COVID, but this was a very unsuspected death. Like, we should be doing some postmortem testing, because we are still so uncertain of how this affects people. We're finding it affecting the pediatric population in a much different way than it's affecting adults. And there's very healthy people that are being severely affected by it, in much smaller numbers, obviously, but it is happening. So I think it's important to rule that out on people where it could be a potential.
Right, right. Well, thank you for sharing that with us. So Kelsey, are there any questions in the chat?
There aren't any questions in the chat. There is a quick note to both of you in the chat if you'd like to read it. It looks like the Facebook Live outage is happening to several other people as well, so it's not just us. Unfortunately, we weren't able to make it live on Facebook, but if you do have questions, feel free to chat them in and we will make sure and get those answered.
Okay. One of our attendees was wondering if Abbi has ever done any work with harm reduction, any harm reduction groups.
So I have not done any work locally with harm reduction groups. I have been in contact with some agencies, some of the assisted living facilities and things like that, to work with fall prevention education. Another good resource that we have here is the Baby Fold, and they provide a lot of education to parents. So that would be a good resource to reach out to and maybe get some teaching for co-sleeping and you know, safe environments for children. So I think that would be another good organization. And then I know some people know that the opioid crisis and just drug dependence in general is a huge, huge passion of mine. I think there's so much stigma behind having this illness. And I come from a family where my mother is in recovery. And so I just really think that there's a lot that can be done for that population. I know we have some things that have been implemented, but I think we need to go back and see like how effective that's really been, how many people have utilized those programs. And if the numbers aren't high enough, what can we do to make that more accessible and for people to be more likely to reach out for that help? So,
right. So going back to the coroner position, then, if you were elected coroner, would you have some clout or some, you know, push, some standing and to help facilitate changing things for the better?
Clout, probably not, but I think that just there's a lot of organizations who are always looking for help, especially in these areas. No one's going to turn down someone willing to come in and try to help build programs or help re-implement some of the things that they have to get better outcomes for people. So yeah, I definitely don't think I would have any clout in that, but these organizations need help. They're not going to, they're there to help the community. So if you're coming in and wanting to say, how can I help you help the community? I think they're going to be more than open to that. And I have talked to some of the agencies and they're all very excited. So it's something that people want.
Right. So there are community people that are excited about having you as the coroner and advocating for these issues.
I think they're just hungry for that change for the community. If you have the ability to do these things to improve the health of the community, I don't see anyone being opposed to that. So I have had very good reception for the places that I have reached out to.
Right. Well, thank you very much. You know, sort of continuing on what you were saying about people in the community wanting better better advocacy. I'm finding the same myself. We don't have a lot of representation from Central Illinois in Springfield for many of our organizations. We don't currently have reliable representation for our unions. All of the representatives and senators in McLean County and most of Tazewell County tend to vote against gun safety regulations. They don't always vote in the best interest of public education. So I'm definitely finding some local people who are excited to have somebody who's ready to be a strong voice for them in Springfield. And one thing I wanted to mention regarding my opponent, now that they're back in session, I know that there's currently a push to either change the language or completely remove the fair tax amendment from the November ballot. And I believe it was Bill Brady who referred to it as a cash grab, and Bill Brady is the senator for District 88. And I would ask if anybody who thinks the fair tax should be removed from the ballot, I would ask, who are you representing? And I'll tell you who. You're representing people who earn $250,000 a year or more, because the fair tax would only increase taxes for those people. And the other thing I wanted to point out, that's a very current event, is to take note of the response that my opponent has had regarding the COVID crisis. And overwhelmingly, my opponent has been completely silent on social media until I think it was maybe one day last week. He posted something on Facebook for the first time in over a year. And this is a time where everybody's at home, everybody's on their computer, people are spending hours scrolling on their phones, and there was nothing from him about how to file for unemployment, where to get food, where the food pantries are, where are the services, where are the mutual aid groups. And I can assure you, if you go to my Facebook page and you scroll, you will find those things on my Facebook page. And I have been doing it ever since the schools closed. And if you go to my website, unite88.org, you will find a whole button with drop-down links to all of our local resources and the state resources for anything that you might need in the middle of this pandemic. And now I'll ask if there's any more questions that have come up in the chat.
Thanks, Carla. There are not any questions currently, but I did want to let everyone know about a super fun, amazing event that is happening this weekend. So if you don't have plans yet, this Saturday at 6, if you go to Carla's campaign page, Carla, the number 4, IL88, the top post is the Doctor Who themed trivia night fundraiser. So you can absolutely join us for that amazingly fun time and learn more about Doctor Who as well as Carla on that amazing event.
Right. Thank you, Kelsey. All right. Well, if there's no more questions, then I'll say thank you, everybody, for joining us, and thank you, Abby, for coming on with me. I know everybody's exhausted. I'm exhausted. The staying at home, we're all tired of it, and even though we're opening up a little bit more, it's still it wears you down. You know, we haven't seen the sun properly in days, that wears us down. And but keep hanging in there, and also remember that both Tazewell and McLean County, if you go to the health department websites, you can find information on mental health resources, because this is a time when a lot of people are experiencing depression, and we want people to know that there's help out there, and that there's always somebody ready to listen. So thank you and good night.
Thank you.
Thanks, everyone.